New whistleblower allegations at the Texas Health and Human Services Commission say state mistakes have cost thousands of Texans their health insurance. Now, these complaints have spurred Texas representatives in Congress to urge federal intervention, prevent more Texans from being kicked off of Medicaid by accident. Ryan Chandler has the allegations and the state's response.
Texas's Medicaid administrator underprepared and overwhelmed, leaving low-income Texans uninsured. It's part of this new complaint from anonymous employees tasked with redetermining Texans' Medicaid eligibility. They say numerous and growing system issues are causing erroneous denials of coverage, particularly impacting newborns and pregnant women, saying 68,000 people were kicked off coverage by mistake just in May, and 5,800 pregnant women were denied postpartum coverage.
About 1 out of 5 of these were apparently denied this access through nothing they did, but because of errors within the administration. And those would not have come to light but for the courage of some whistleblowers within the agency.
Texas's Democratic congressional delegation is urging the federal Medicaid administrator to intervene and require Texas to stay in compliance with federal standards.
Kicking off poor people, denying them access to getting a family physician is the exact opposite of what we've been trying to accomplish.
Texas Health and Human Services tells us redetermining Medicaid eligibility for approximately 6 million Texans in 12 months is a massive undertaking, and HHSC has planned this unwinding effort for more than a year. Of the almost 100,000 Texans who were erroneously removed, all but about 2,000 have already been reinstated. The employees say many of them are now seeking other career opportunities or seeking protection from retaliation under the Texas Whistleblower Act, saying the environment is toxic and we are in a constant state of fear.
And that was Ryan Chandler reporting. HHSC leaders say they will be down to just 1,200 cases, waiting to be reinstated by the end of the month. Now, if you need to enroll in coverage, visit yourtexasbenefits.com.
So how exactly did we get here? Well, when the COVID-19 pandemic broke out, the federal government declared a public health emergency. In doing so, Congress passed a law allowing people to automatically keep their Medicaid coverage, also called continuous Medicaid. But a new law ended that on March 31st. So now eligible recipients need to renew benefits at the correct time or risk losing coverage or having a gap in coverage.